authorities that has been reported during a financial crisis. There's discussion about them being acquired by North Mississippi Medical Center or perhaps someone else. What can you tell us about the situation that they're dealing with in Greenwood?
To understand what some of us are concerned about. There was a Medicaid program to send some money to hospitals. The funds were sent out based on the previous year's data. It was always the case that at the end of the year, there would be a recalculation based on the current year's data, and the funds would be evened out debt. The client services in Greenwood was so great that the drop in year 1 and year 2 was $785 million programs. That's where the overpayment came from.
Okay.
Actually, nobody did anything wrong. It was how the program was set up, and there was more development services in Greenwood than anywhere else. There's a plan to repay that, and nobody denies that it needs to be repaid. I don't know, maybe $500 million a month. In December of last year, out of nowhere, the governor had mandated that the December payment be used about $2.5 million. That would not be the hospital with their cash there, and the hospital would have closed for Christmas. The trustees went to Chancery Court in Madison County, and the chancellor granted an injunction limiting the amount of money that we available for Medicaid payment. I don't know the exact figures about that. But that is where Greenwood, who's not counting on the House now, got involved. We filed a letter with the court that said basically we want to do something to help solve the problem in Greenwood in the legislative session. If the hospital closes at Christmas, there's nothing we can do. As I said, the injunction was granted by the Chancery Court in Madison County.
And this goes on. I do not want to. You can go back to YouTube. I'm sorry. Okay. So there were a couple of things when I saw this that gave me pause. The first is that Paul Bryant is a senator from District 7. Okay. That's, what is it, Lee to Shamil County? He's over on the other side of the state. Okay. Paul Bryant is not from Illinois County. The other thing that gave me pause is that the governor has his hands on how much? $200 million that he has the discretion to do with what he wants. Now, that's not the truth. The senator said it was. And in fact, there was a debate in the legislative session about whether there ought to be accountability and oversight in terms of how that money is distributed. Should he be able to just decide who gets it and who does not? I say to you and to us, this is why every election matters. It matters. We have to be able to advocate for ourselves. We have to be able to know somebody should be able to have a conversation with the government. There might be somebody in this room if you had an election. But there should have been advocacy. And we don't, again, it doesn't mean that bankruptcy in this course is not the course that we left. It's definitely the course. This is where we are. The reason town halls are necessary, the reason I wanted us to come together and talk about what's happening is because many of us were not aware of that. And it's important that we remain aware and engaged in what's going on. There's an emergency. This is a healthcare emergency, not just a financial issue. If the hospital closes, access to care becomes a matter of distance, and distance can cost lives. We already face disparities. This is going to deepen them. And we're looking for solutions, not silence. Solutions, not silence. Hospitals don't just close. They leave communities behind. As citizens of Leflore County, Greenwood, Mississippi, and in fact this region, we have to refuse to be left behind. So how do we empower ourselves? We stay informed and attend public meetings, and if there are not public meetings happening, we need to call for them. Or we need to get together and have them. This information that you have, some of you already have it, but does everybody in your church know what's going on? Does everybody in your social civic organization know what's going on? Does everybody in your neighborhood know what's going on? Because it impacts all of us. Every one of us in this community. We have to give GLH a chance before you go to another facility. Because that's important. We saw over and over again that this reduced patient flow. Now, I'm not saying if you've been ready to have a baby, that you don't have to go somewhere else. I keep on this baby thing. Mr. Brown, don't pray. But there are other services. If you need a urologist, and if you need neurosurgery, then you have to go somewhere else because we don't have those services, right? But what you can get at home, let's get at home. So that's the way we can support the hospital. And then let's share accurate information in the community. There's a communication role. And it's up to us to ask for it. It's up to us to get any individual in this room with additional information, have the power and the wherewithal to do the same thing I do. Call Mr. Johnson saying we have room, because we need to have a discussion. And so again, we thank you. You can turn the lights on. I think that is the last slide. I actually do have no. That's not. Oh, we're ready to turn the lights on. Because see, when there are not discussions taking place in the community, things happen. In this same legislative session that just ended, there's another bill that you need to keep your eyes on. That's Senate Bill 2523. Now, it didn't pass this time, but it had to do with how funding will be determined for our IHS, for the institutions of higher learning, for our state colleges and universities. They want to go to a performance-based funding mechanism. Sounds good, right? You perform. But there's certain measures in that that are going to impact us in Mississippi Valley State University and hit us hard. And a congressman or a legislator has already said that consolidation is not off the table. It's not off the table. It died this time, but it's coming back, and they made it clear that it will be revived. So we have to stay informed, and we have to stay engaged. I'm going to turn this over to my co-facilitator here, Mr. President.
Please turn it back on. One be 5 minutes anymore. I think it'll be a little bit more direct, and I think that's fair, considering what we're doing with. Elections have come. I know you have heard that. Let me tell you how this thing happened all of a sudden. All of a sudden. We have a senator, a little man, great family. This Kavanaugh is the senator for North Greenwood. Our senator covers the risk. All of us. Okay? You got that? Ms. Kavanaugh wrote a bill that allowed the hospital to file Chapter 9. Chapter 9. It was 11 to 9. And our senator supported it. I wish he was here to explain that. Because, believe it or not, we were kind of hands. This is $11 million that we all signed on to pay because we're trying to save the hospital. Well, when the university comes in, do they accept that liability or do we? If I was them, I would. But why all of a sudden that happens? Elections have consequences to the door. We looked at the Secretary Act is 100 miles away from us, and he works for another hospital, I'm told. So I can't see why anybody that works for another hospital are competitors. So we have our best interests at heart. I don't see it. I could be wrong. And I hope I'm wrong. But I got questions that I didn't deserve an answer. Because guess what? Our politics, to be honest with you, is very toxic. Our politics in the Fulton County is very toxic. Now, our politics is like very. Don't get in an accident between here and Grenada and that hospital down here. And I experienced it personally. This is a dry run to close out the state of emergency. That's all it is. It's a dry run up to that. But it's introducing that right now. But it's a dry run to what's going to happen. You saw somebody else on the other side of the state talking about Greenwood for us. Think about it. Think about it. Jackson is a Republican. Got nothing problem with Republicans. They run the state, in the House, and the Senate, they had governorship. I just wanted a little more fight from my senator in this regard. She wrote the bill. I would have appreciated it better if he had wrote. She wrote it. And he signed on to it. That's a problem for me. That's a problem. Because in this situation, it don't matter black and white. When we vote for somebody to represent our interests, we mean that. And Valley State University costs about $70 million in this economy. And God help us. That happened. The hospital comes in more than that. And now we're in a situation where we've been stabbed in the back, and the best that we can do is for someone to put cash money out. Not put it out. Not get stabbed in the back. That's what we're talking about. Because our policies are just that toxic. We got to start holding out elected officials accountable for something. Don't we deserve that? We don't have to be in this kind of situation. We're in a terrible situation. We got too much killing going on in our university room. I can say that way. We got too much shooting. Let alone everything else. And for our elected officials, now I will say this. I'm glad I married him tonight. Thank God for him. He's fighting for this. He's doing what he has to do to try to have something for us to have. Our city council and our supervisors. That's how they gave us that access to the 11 million. But what the government has, the 200 million, we depend on our people in Jackson to help us. We send somebody to Jackson to represent us. They're there 3 months out of the year, every day in, day out, that office upstairs. You don't take the reasons to the Republic, but you're there, talk to them every day, sit the steps, save our hospital. You're going to tag on with another Republican to go on with chapter 9. I have a problem with that, Senator Jordan. I have a problem with that. So all I'm saying is, let's hold our elected officials accountable. Why? Because we deserve it. We want to stay. We want to live. And guess what? We might want our kids to come back and stay here, make Greenwood a better place. Let's keep the green in Greenwood. But right now, we're locked up. And I just don't want to shift over there.
Question.
And there's a question to answer. I'm doing it.
Did you all invite Senator Polk?
Also, we invite the city council, the mayor's here.
Did you all
The
invite?
mayor just found out 3 hours ago, somebody sent me a screenshot. I
Is
didn't
the front page there?
get a personal, so I think this not quite accurate from their regards. When I got the message through a screenshot of it, no one reached out to me about this town hall. After it was across my team, I came. I do have some.
Wait, let me finish. That's not. But in the paper, on the first is on the paper. WABG, we invited. It's on the cover of the cover. We invited. That's all the officials, city, supervisor. Everything is in the city.
But the discussion. But let me share this as well. Even though there was a public invitation to all these entities, this discussion is for the community, for citizens, because we didn't want it to become a situation where we're just sitting here with decisions have already been made. We want to hear from the community. We want to hear your concerns what your positions are, your considerations, because then we will put those together and share those with the people who are making decisions. At this point, there's some decisions that have already been made. We're already here now. That's like saying, okay, the debate is here now. So now we have to address what's happening and where we are. Thank you, Mayor Cox, for coming. Even if you just thank you that you're here. But really, it wasn't for those individuals, because we could have easily said, let's have a forum and let's come in here. But my position is that we should have been here all along. We shouldn't. This is the 9th hour now. These conversations should have been happening. This started the most recent, about a 6-year period. So this didn't just start. There are already decisions that have been made at the local, state level already. So we're here. That's a done deal.
But the implication was about including recommendations. I insisted on that because that was what we just asked. That's why it's the front page of the conference. But, and I will definitely reiterate what my wife was saying, the problem has been even elected officials who are here and not here, and somebody that's coming here to talk. Everything that's happened has happened to us, not with us. Everything that has happened to us. We're reacting to this. That's what partnership is taking place at right now. A lot of people that got terminated in hockey didn't even know it until the end of the day. So all I'm saying is, I'm just glad people want to talk about it.
So,
Thank you.
until I went out to the office as mayor of City of Greenwood. 3 days into the office, I had a meeting with the city council supervisors, representatives with the hospital board. They informed us that the responsibility of closure in September. However, we did whatever we need to do, sent out letters, contract, Congress, things of that nature. The transition from September to end of December. From the end of December to March, and yet we're still here. So there's efforts are being made to make sure that we still have a hospital within our county. Hell, we're still fighting. We're still forced to make sure that we still have a hospital in our county. We did do a letter intent with UMC that been placed out there. So it's not that we're sitting idly by to lose it, because we know the very importance of the hospital. I was born in the hospital. Many of our people that we come, we need the hospital team to make sure that the city of Greenwood thrives. The thing is, there's a lot of things that transpired before our hands. We're looking at legislation where Medicare stepped in and said, hey, you don't pay y'all $5 million. We want that back tomorrow. And we was in the transition phase of trying to get our swing beds open with the hospital to make sure that we generate enough revenue. However, it took us almost 7 months to even have a conversation with an actual person, to even have a conversation to say, hey, what is that we need to do to make sure that we get the certification of swing bed? All this information has been placed in Commonwealth. I'm pretty sure that the reports came, shared, say they're in there or not. So it's all the information that I'm saying now is being well documented. So when we had the opportunity to talk to somebody in August, well, Greenwood for a hospital district, I spoke with somebody, then they were like, hey, let's have a meeting on how we can get to point A to point B. Many discussions being had. We'll say no, they'll say no, they'll say yay, they'll say yay, come back and forth. So it's just been a bunch of back and forth. And then so when we couldn't get a meeting, we had to go to court. And the last option was bankruptcy, to make sure that we cover ourselves, to make sure that we have the money to pay skin. So, because we didn't have $5 million on hand where we was overpaid. When Medicaid paid us, they don't give us a specific number. Hey, this is what you're supposed to be. They go based on, I can't give you the logistics. I'm very new into the process of how they identify how much money Medicaid is placed before it being placed into the hospital. But however, there's people are working hard to make sure that we have a hospital in Greenwood. Even in the wee hours, there's still people who are pushing and fighting. I am one of those persons. Senator Pope is doing his job, is doing his due diligence and trying to make sure that we have a hospital in Greenwood. So don't look at the concept where we're sitting on our hands and okay with what it is. We're doing the due diligence. We understand your frustration. We understand your fight. I don't want anyone to lose their job. However, things happen. And I'm not saying it's right, I'm not saying it's wrong, but that's where we're in the wee hours. And we're fighting, we'll continue to fight to make sure that we have a hospital going forward. Now, Greenwood for High School District did, they are in the process of going bankruptcy. So that's where we at. So I'm sorry.
So Mayor, let me say this, Mr. Brown, first. We appreciate what you just said.
Yeah.
How many of you have heard that?
Thank you.
And that's what so we understand that it's out. And if there's any impression that we'll land this at your lap, that's not. What we're saying is, let us know. Tell us what's going on. Because what you just said, there's some people who are able to say, okay, we got it. We need to hear that. We need to know that. And you just a perfect example. Because the Commonwealth is not guaranteed that the word is getting out. My mother-in-law is 94. She just knows the phone rang, and they said I can't come back to the hospital. That was her. Okay, she's not the only one. She's not the only one. So when you communicate, when you say, if all I'm reading is no comment, when you communicate with us, then that opens. Now, we know when you're negotiating a deal, you can't disclose everything, all right? But at least say, this is where we are, this is what's happening. Because then we can go back, and that takes the anxiety down a little bit. We know you're fighting. But it was not about sitting that in your lap, because we know you got enough in your lap.
All right, let me also reiterate that it's all under those circumstances. I always say that you are going to fight. We know you're fighting. That's why you got to let them in. We're on the team. We want to help. All we're saying is, let us help you fight this battle. The problem is, and it's not even something you can do. The government is sitting on $200 million. You're not in Jackson. We didn't elect you to go to Jackson. We elected you to be here in Greenwood. Okay, we depend on the people that we elect to Jackson to go and talk to the governor's office. They're there 3 months out of the year. Go upstairs and talk to governors. Don't go with another Republican.
So,
I have no problem with walking across the aisle, but let's not walk across the aisle to someone that's going to let us file Chapter 19. Let's walk upstairs about getting some money. He has $200 million that he did. Now, I might be walking the way you walking to. That's problematic. Chapter should not let be the one who writes the bill for just no reason. We're talking about all the reasons. So that's all I'm saying.
It's not just
It wasn't original, to be honest with you.
it's all. We're representing the whole community.
Right.
I mean, I am a nurse. Medical Report gave me my card. And right now, I've been working in Greenwood at the hospital. And it's not just Greenwood we're on the forefront right now. It's going to be other communities that's going to be having these problems. We're not educating ourselves. Us being in healthcare, we see it every day. A lot of times we can't say things, but we see what's going on. We see that there's a problem with getting funding. We see that there's a problem with getting money for services that we need here in our community. We have neurologists. Greenfield does not even have a neurologist now. He left, he's gone, he retired. So we looking at people going to, and I work everywhere. I work in Starfield, I work at Winona. I can remember just recently us trying to get a patient out, and we called everywhere, even Memphis, trying to get this patient out to get the services that they need. People are going to lose their life. It's not a black thing or a white thing, it's a white thing. All of us. I know somebody in this room who had somebody who had a heart attack, somebody in their family who had been shot. lose money. That's just the bottom line. And not only that, Greenwood was some of our biggest employees. You're looking at people losing jobs in the Delta. There are no jobs here in the Delta. I have 3 sons who are now have been looking for jobs for months. Going everywhere. I'm encouraging them. One of my sons just came back from Texas because he had issues, but encouraging them to get out. Like, I don't care, get up, let's do it. They've been looking. There's no job. A job with benefits. That's a different thing. I did a live, I think last week, and someone came out of there saying that when I said that about the insurance, yeah, he said, well, 60% of people in Mississippi have private insurance. Private insurance paid by the government is going to have 42% of it. So I've worked here, I've worked there, I've looked into insurance. Insurance is based on the amount of money that you make. And you can't afford it. If you make a little money, you cannot afford it. Now that's the issue that we have, y'all. It is so important that something is done. Yeah. I'm talking about lives. We're talking about our elderly that can't get places. You're talking about transportation. I work in healthcare. It's hard to even get people a ride home these days. So it's bad. It's bad, it's bad, it's bad. And something needs to be done.
You understand what I'm talking about?
For the song.
I can't. I want to clear something up for everyone. It's not black and white. That's not really a Republican package. The problem is the Republicans that make the decision. That's a fact. I'm not guessing. That's a fact.
Could you repeat this?
So all I'm saying is that
Just say about decision keeping people to say.
okay, it's not a Republican or a Democrat or a black and white. It's all of us together. But if we're going to stop the Republicans, we're going to have to negotiate with them. Because it's just more than one time right now. And if you're going to negotiate with the Republicans, and you're a Democrat, I'm much better negotiating with the money than the one who you're checking out. That's just what I feel about it. And especially if they're the one that I want for. I want them to protect our hospitals because that's what Valley State is next.
Yeah. Y'all excuse me if I get a little emotional. We need to get to the problem. The parents need to know what Greenwood Leflore has gotten to this. Okay? So we're going to sugarcoat this. I came to Greenwood Leflore in 1987 at 20 years old. We had patients on the first floor when I lived at Greenwood. I was on the first trauma team at Greenwood Leflore, along with Dr. Luther Street. We had every specialty. The hospital was full. What happened? What happened? We made money. We made money in income. And I was 20 years old. Mr. Jordan sitting back there, like Mr. Jordan. He had to come to my rescue one time at Greenwood. We had top nurses. We had top doctors. But the good buddy system is what happened. We're not going to sugarcoat it anymore. Amen. We have paid people money because they was from Greenwood, Mississippi. Not that their clinics were making money. We paid them because they were from Greenwood, Mississippi. Amen. Along with travel nurses who we had to bring in to take care of the patients. Let's agree with that. But you had nurses who were capable of taking care of those people who made less money. Nobody addressed people coming in making $5,000 every 2 weeks, and there's a nurse that you have to verify versus nurses making $2,000 who had years of experience like me in every specialty that could work anywhere in Greenwood Leflore Hospital. And no one came in to investigate on who was being paid what and why. We had jobs there. They didn't have a description. It was just written down what they were doing and getting paid. You had clinics
that was paying out $18,000 a year, wouldn't even make $18,000 a year. So again, we're still shutting everything up under the rug about Greenwood Leflore in this land. I have been in this game 39 years this year. I left Greenwood Leflore in 2009 as one of the charge nurses in the hospital. Love Greenwood Leflore. They made me the nurse I am. But if we do not ask them to produce the paperwork, to show the money, or the people that you cut, how much money will they make? Did we cut any people? You got a one-bed hospital with how many infection control nurses? Y'all, let's be real about this. Let's be real about this. Y'all don't know what Greenwood Leflore, but it ain't not been for years. But I have a proud supporter of Greenwood Leflore. I have a very proud supporter of Greenwood Leflore. But it is still being shelved under the rug on what has happened with the services and the money. We have physicians who are top notch. Why did they leave? So I'm saying tonight, no longer under the rug. Let's bring up the problem and how we fix it. We go down there, we ask the government for some money out.
And I'm going to say it to him. I want to know how I feel. That's why I don't understand that. To the door of the word.
Thank you very much. Let me say this. You're going to get the resources that Chapter 11 will bring. You're going to get the money. But listen to me. According to Dr. Lucas, I talked to him twice. The young Dr. Lucas, I didn't know him. He knew my son, the full hours. And what the problem is, we need to make the person obey. The governor going to release it, according to Dr. Lucas, the person of June. So it's a matter of trying to talk to Governor Reed. Now I had to be at Jackson one day last part of this week. On most cases, I could walk in and just talk to the governor and he's available, rather than trying to make an appointment with him. Because when I talk to anybody, I like to talk to them face to face. And so you don't get your resources. But not tomorrow by noon, you're not going to get them unless somebody would talk to you. Chapter that was the right thing to do. Fine. Whatever it is, Chapter 9, back up. Yeah. But the money is coming. It's kind of a month too late. We need it now. And I want to, if I get a chance to talk to the governor, I want face to face. I don't want to call and try to talk to him on the phone because I want to see his expression and his action. I'm willing to do that, but I can't get to Jackson until what they completed. I'll try to see him. But if you don't get the resources, we need the first debate. The governor said he had it ready the 1st of June. So that's what Chapter 9, Correction 9 does. We need now 8 people have been laid off. Now, I didn't know that the young doctor knew, but I've been dealing with his dad for the last 30 years for different things, having been sent to different places. But the younger one said that the money will be available in June. We need the further amendments. That's what I thought. So I'm trying to see the government face to face.
And I'm grateful. Thank you, Senator Jordan. I'm grateful. But listen, go listen to what he said to us. There's someone.
Dr. Brown.
Oh, it's right there.
Yeah.
What I appreciate you. Thank you, Senator Jordan, for that timeline letting us know. We didn't know that. And we wouldn't have known had we not come together and had a conversation. We live in, and that's the premise. That's how what drives me is the lack of information and communication. When I shared the part of business that I had students who I had to tell them, you have to sit down when I didn't hear. It wasn't good news. They were hear it. But I think they appreciate me more for being honest than for not saying anything, and then they're losing scholarship and showing up and not telling them you can't go to class. So even the bad news, even the delays, even when there's something else to be done, all we're saying is tell us. And clearly there are those who know. If Dr. Lucas knew, I feel better because George told me what he said, but I would have known what he said. The lack of information is the crisis in our community. That's the crisis. I'm coming over to spread it. Anyone else, please raise your hand. This is a community conversation. So raise your hand. Whatever thoughts you have, I'm coming back to you. Wait. My name is Barbara Gray. What I want to do is thank you, Senator George, for your service too, and for your information tonight. That's important because now we know what to talk about. But we need to know something before doing. Right. And that is, why did you come to this?
Yes, there you go.
Right. Why did you come to this?
Right.
You know, we got board members that's sitting on there for years and years and years, and boards have turned over. If we have these people sitting on there and this happened, we may not even need these people. Like they put those conservatives over and take all those board members away that allow financial disparities in different organizations, schools. So we need to think about that. Yes, we need that money. Yes, we need to go to him and ask him for that money. Don't demand nothing. Ask him for that money. But we need to know when that money gets here, we got somebody that's going to protect it this time. The house and everything. And I think that's very important to do that, and know that. And you got all this time, now we have this time, and I know that there's a process to get to keeping the hospital open. We have to make sure when we get it open, we not put it back into the hands of other people who help us get it to their reality. And it's April 20th. May 1st is coming. That's next week.
And let us not forget now. Let us not forget, we're talking about somebody else. The governor can give us the money and we can keep our hospital. He had the ability to give out what it needs, and we don't need to go for that. So there's another beauty thing that we're not being provided. And that's why I do a good talk. And you know, so why is the ex-administrator being paid?
Yes.
Why is the ex-administrator? He's not even the administrator for it. He's ex-administrator and still getting his hands on as a consultant. He didn't fix the first time, right? He did something. See, those are the kind of questions we need to ask. Those are the kind of questions we need to ask. I just hate it. I just feel sad that people this kind of stuff, they take us for granted to have all these meetings and decisions, and they feel comfortable enough to invite. My wife and I, really true. She said, we got to do something, bring people together so we can talk about this. And we learned a lot tonight just by coming together and talking about it. And this does not need to be the last meeting. Guess what? They know if you start meeting and talking, they're going to be a little more hesitant to do the next step. Because they're going to know we are discussing, we are talking amongst ourselves, and they will stop this stuff. I'm tired of reacting. Any other questions? I know we got another question.
There's one.
Get on there back.
Thank you. And we were just out came into a return Catholic church. I was comparing the church so that you know, Greenwood not lost. I don't hear the sound. So God brought me out overlooking some great opportunities to know that they work here. But the key thing is that the whole May comes, and June comes, I work in corporate finance planning for extra time. We need to come up with plans. You ask for money, no organization will give you money unless you know, are we going to become a regional emergency hospital that already agents? We need to know how we designate ourselves, come out of this mess. And so, we don't need to wait until June. We need to have a planning committee together to determine how we're going to set a hospital, which definitely we have to keep. We got to look at the disparities to determine we can't do without OB. We got infant mortality. We have to do those services that we cannot lose and set a plan and a budget and say this is what we're going to do with the money. And do outcomes, see how we come out of it.
And we're going to get ready to wrap this up, and I will say this, for those people who want to be a part of that committee, if you'll stay 10 minutes afterwards, let's discuss how we go about getting that information, so the next time we call a community meeting, we'll have some other things to add to. Because my wife really did this thing by herself, in regards to research with Jackson and where I get this information at the car. Senator George said something, I don't know if you all quite caught it. He said he was going to go talk with the governor.
Let me say yes. I'm going to try to see.
You're going to try to see them. But understand, you have to send it to them on paper.
Don't get my drift.
Okay, I'm trying to talk in somewhat code, but I hope y'all understand what I'm saying. Elections have consequences. That person I wish to feel that. So we can ask him to have cleared up for us. And I'm doing it.
And we respect your time, so we are.
Good afternoon. It is just in my mind, it's what can we do? I understand. Do we need to go to Jackson? Go to the gathering?
Yeah, it sounds like maybe if he knows that we are.
Like we can get together and show up as a poor county, maybe we can be effective.
I totally agree with you on that. And that is something, I know some of y'all may remember, I walked down from Valley School. It took me 3 days. Guess what? When I went to ISL, was in there, he did that video work. But they really got on the baby. And the folk got mad at me, they didn't even know. But they got to know, because he drive a little bit too easy. There has to be some sacrifice in there. I mean, I would never do it again. But it was something I was trying to do and I did it because I cared about bad FD. But having said all this, and you come to that and I let Dr. Brown make us fun. Thank you all for being
And I'm going to say, to those who said their voices to this conversation, because it's very about us.
People need to go to the hospital supervisors. One thing you need to do, if you care about it, is go to the hospital to hear meetings. They're open to the public, and so.
What is the next one?
I'm not sure exactly.
Every Tuesday?
Third Tuesday.
Very Tuesday.
Well, that was, that's tomorrow.
Is that the third Tuesday?
Tomorrow's the third Tuesday.
It is tomorrow.
What time? What time? What's time?
I think 11.
10 a.m.
He thinks somebody knows, he thinks somebody knows what time hospital we're here.
He's saying that.
And then, we're leaving, and then eat at the hospital.
You know what floor is? First floor.
Let me, I want to, again, thank you all. We want to have a good conversation. My vision is not to have a panel of folks sitting up here talking at us, but that we could talk to each other to get an understanding. And from that conversation, we gain some information, and we can talk about what we need to do next. I would say we have to be out in that. It means showing up at the board meetings, at the hospital. It means showing up where the decisions are, whether it's the board of supervisors, the city council, wherever the decisions are being made. I appreciate you for able to sacrifice being here tonight Healthcare is not an option. It is our right, and for all of us, no matter who we are, what we have, or where we come from. I appreciate you. This will not be the last time. We're going to go get the folks we need to know and bring them back into the room. But they have to tell us we have to be informed, and we should have to do an FBI search to get information on what's happening to us in this community.
Mr. Booker's on the phone.
No.
Oh, you want to talk to him?
No, we do it now.
I said it.
Hold on, wait. Look at everybody, go to the car, we did this. Number 30. Number 30, tomorrow. Number 30. So we got to wait. If you great person, you get in the tomorrow, number 30, thing. We're not going to go on. Nah. No. You could have been here.